One of the important elements in assessment of dual language learners is language samples, right? Because standardized tools are so often biased and result in misdiagnosis. One of the problems, however, is that many SLPs feel unsure of really what to look for when they are evaluating a dual language learner. What is indicative of a disorder and what isn't? In terms of mazes, are there big differences in what you're looking for in a monolingual child versus a dual language learner?
I'm looking for in a dual language learner is I want to see what is the purpose for the use of mazes. So is this child actually exhibiting more maybe verbal hesitancies and then pulling a word from a different language to try and fill a gap in what they're saying? Or are they actually exhibiting a lot of verbal hesitancies and then not saying very much afterwards? So maybe they're trying to just hold the floor for their communication. Those children tend to have a little bit more challenges processing information, etc., versus children who are actually using mazes for more of a purpose to continue their message. And so we see that in dual language learners. And when we're looking at language samples, we want to try and not only identify the maze, but try and see why are they using it? What purpose did it serve here for them? And there are different types of mazes that we see where we can get some of that information. So hesitancies and fillers like kind of utterances like that. That don't have any content-specific information versus a child who might be revising a phrase. She went to the store. So that type of revision is indicative to me that the person reflected, caught their error quickly, revised their message, and continued, versus somebody who maybe exhibits a lot more verbal hesitancies that don't contribute to the content of the message.